I'm Jake Baggott, Associate Vice Chancellor for Health and Wellbeing and Executive Director of UHS. So, what's really important to the success of all of our planning is that we have those testing sites up and operational, and happily we were able to open our first site yesterday on the Henry Mall, and that was launched, and we've already had some success from that first day, and that will continue to remain open for the duration. We're also planning on two other testing sites, and more details about those will be released very soon. The Henry Mall site currently is a walk-up testing site, and so that's the way that you can access that. But you would need to use a scheduling process to schedule an appointment. There are multiple appointments available throughout the day, and they're scheduled in 5-minute increments. That process, very much like the Dane County Alliance Center site, will allow us to move people through efficiently, as well as avoid queues that might develop otherwise. We'll actually add a drive-up component to that site next week, Tuesday, as the plan for that. All these things that we're doing that others have spoke about, the public health protocols, are really having impact here in Dane County. And as of today, the 7-day rolling average of positivity is just over 1%. So that we know that those things are working, and that's why we've implemented those same kinds of protocols here on campus. So also important to that is contact tracing, and so UHS has a long history of collaborating with the public health department here, and that is even more true on contact tracing. So working with them, with their protocols and their training, but focused on our campus, we've onboarded a number of staff that are specifically focused on contact tracing for the campus. Actually, as of today, we have 42 staff that are focused strictly on that effort. The other thing that I wanted to speak to is around isolation and quarantine. So we've made very significant plans that if we identify somebody who's positive, who's a student here and a resident of our campus, that we have the facilities to support them, to move them to an isolation if they're positive, or a quarantine space if they are considered a close contact. And then there's all kinds of protocols established to track them throughout their stay there, daily check-ins, monitoring, and supports that are necessary for their success, while they continue to work with their faculty in staying on track with their academic work. So the other thing that we wanted to talk about is the positive case protocols. So if a student or a staff person tests on campus at one of our testing sites, which we expect many folks will take advantage of, the nice thing about it is we're going to get those test results directly back to UHS, and then we can start to share that information appropriately, as well as begin that contact tracing process. One of the first things we'll do, of course, is when those test results come back, is we'll reach out to the person who was tested, let them know about their test results, and then give them instructions, depending if they're an on-campus student or if they're an off-campus student, how to support them during that experience. If you're a staff or a faculty member, we'll also be contacting you to share that information with you. If you're an employee, it's important that we notify the divisional disability representative in each of your units, so that they know, first of all, how to support you as an employee during that process, and that so appropriate steps can be taken within the department. And that's going to be coordinated with environmental health and safety. They will also, evaluate the circumstances and make any necessary changes that are appropriate there. We're also working on a process that if a positive test comes through, that we can let a faculty member know that somebody in their class has tested positive, and so that information will be shared. We can't share the specific person's identity because of privacy, but we will provide the student with some documentation as part of that contact tracing process that they can share if needed, to support them during that period of time, that 10 to 14 days that they might not be able to be in person in class. Because of those physical distancing protocols and the face coverings, as was mentioned earlier, that shouldn't cause others to need to be quarantined under those circumstances. But we'll evaluate each circumstance specifically to make sure that we're managing those appropriately. We'll also make sure that the students recognize they need to contact their faculty members and maybe their academic advisors to get support during that process as well. If you get a test result and it's not something that was conducted here on campus, and it possibly even done outside of Dane County, we're going to provide a mechanism. Actually, it's already up and operational so you can notify the campus of your positive test result. It's an email, COVID results at wisc.edu, as well as a phone number that you can call, 608-890-0000. I think there's another zero at that, but that number is posted so you can report that, and we can go ahead and begin that notification process to support you and the department during that period of time. One of the questions that frequently comes up is, what happens if I get a positive test result? Obviously, depending where that result is, if you hear from campus, we'll already be initiating those protocols. But the most important thing for you to do is, if you're at work, is to go home and stay away from others, to follow that isolation guidelines that you're going to get from the contact tracers, and let your supervisor know, so that they know not to expect you in the office, and we'll support you through that process with the contact tracing process.